So now we will talk about some of the key features of a GRAS. The first is that an FDA submitted GRAS dossier is not an FDA approval. I think this is a large misconception in the industry. So when you receive a no questions letter, it essentially means that the FDA has no objection or no questions to your conclusion that your ingredient is GRAS. So it's more of a scientific conclusion rather than an official approval, but it still provides regulatory credibility. Second, it relies heavily on publicly available data. So here, transparency is mandatory. And this is based off of the common knowledge element of a GRAS conclusion, which is a major distinction from an NDI. And third, GRAS status is tied to the specific ingredient, use level, and food categories. So the intended use has to be explicitly stated, and this would be food categories such as dairy products, bakery items, protein powders, among many others. Now, if the intended use or the serving levels change, then a separate assessment would be required for reconfirming its GRAS status. A GRAS dossier incorporates the ingredient's identity, information on the manufacturing process, and it also takes into account toxicity data on either the ingredient or similar ingredients to establish safety. Now, because GRAS focuses on food use, this means that the evaluation is not just about the ingredient itself, but it's about how it will be used and consumed in food. So, for example, what food categories will it be used in? How much will people consume of those food categories? And what does the total dietary exposure of the ingredient from its consumption look like? So this is where dietary consumption data is required. So GRAS is fundamentally a population-based assessment and not just a product-based one.